I think that many people don't realize how many women are actually losing their hair. Over 50% of women are losing their hair. And that's millions of women just here in the United States alone. But women are really good at hiding their hair loss. I see those women every day in my office, and they come asking for options for hair loss. And those options can be medical or surgical. Oftentimes, the medical option fails because it's Rogaine or minoxidil, and it's not a great option because it doesn't grow hair well. And by the time I see these women, oftentimes they've lost their hair already. And so we talk about the surgical options. But before we can do anything to a woman who's losing her hair surgically, we need to confirm that it's actually hereditary hair loss. Women tend to have the unfortunate problem of losing their hair in a different pattern than men do. When men walk through the door, they've lost hair here or here in a very select pattern, and we know that's hereditary hair loss. With women, they tend to keep their hairline, but thin throughout. And so that hair loss could be hereditary, or it could also be from hormones, it can be from anemia, it can be from iron deficiency. So we need to do some blood work, usually first, some simple tests to make sure and confirm that it's hereditary hair loss, because we don't want to transplant someone who's losing their hair for medical reasons. And so those women that kind of pass all the tests and we find out that it is truly hereditary hair loss have the option of surgical hair restoration. And the surgical hair restoration is wonderful for women because we're able to take hair from the back of the head, move it to the front and top, especially the thinning areas on the very top where women tend to be losing, and thicken up those areas. The advantage women have to hair restoration is they keep their front hairline, so we don't have to place a lot of tiny little grafts or try to recreate a front hairline for them. All we have to do is fill in, and the fill-in part is much easier to do than creating a front hairline. So women are at a little bit of an advantage once we find out that it's hereditary hair loss, in that all we need to do is try to thicken them up.